Thanks for coming, everybody. Some of you who have read our previous reports know that we've made comparisons between the response to this current recession and the way the state responded 20 years ago to the recession of the early 1990s. And those comparisons focused a lot on the difference in tax policy and the fact that the Governor Snelling and the legislature then were willing to raise taxes, including raising taxes on wealthy Vermonters, rather than cut services at a time when people were most in need. And what this report does is try to look at the spending and compare spending 20 years ago to what we're seeing today. So I'm just highlighting this one item that you'll see in the report. This is a chart that compares human services spending during the period of the recession in the 1990s, and then what the governor's budget and the House budget do, for this recession. So what this shows is these are the increases in the early 1990s, and what this shows is the spending growth from before the recession started, and then how much spending grew over the next 3 years. These two sets of numbers go from 2008, just as this recession was starting, and what happened to growth over the next 3 years, as we see in the 2011 budget. And what this chart shows is the blue is federal spending, green is all state funds, and then we've broken out just the general fund. So what you see is 20 years ago, there was a big increase in federal funding in response to the recession. We had about the same increase in general state spending, and then this increase in the general fund. If we look at the governor's budget this time, he's relying on the additional federal money we're getting, so we see an increase in federal funds. But this is the growth in state spending on human services over this 3-year period. It barely increased, it's essentially flat. And general fund spending has actually decreased. And then if we look at the House budget, more federal money has come in since the governor presented his budget. So there's even a bigger increase in federal funds with the House budget. But then if we look at the commitment of state resources, overall, total state funds dropped, and the general fund has dropped considerably in the House budget. We think that this really illustrates a change in commitment to investing in services that benefit all Vermonters. Things like poverty and drug abuse and neglect of the elderly, and those are more than indicators of just what's happening to people who are suffering from those ills. They're really a measure of the health of our society. And in fact, we used to track that, and we don't seem to pay attention to that so much anymore. As we say in the report, we've really switched from a commitment to people to more of a commitment to money. Now our goal is really on balancing the budget, and what that translates into is, trying to find some way to reduce the caseload, or if you can't do that, at least reduce the cost of the caseload, instead of looking at the overall goal, as I say, of the health of society. So we can look at the numbers and see this change in commitment. We also hear it in the rhetoric. We hear the speaker talk about, the Speaker of the House talking about reanalyzing and renegotiating the social contract between the government and the people. The governor says we have to accept that we no longer can afford the level of services we've come to enjoy. That's really a switch from what we heard 20 years ago, when Governor Snelling said in his inaugural address in 1991, we cannot and will not set lower standards for the education of our children, for the health of the population, for the assistance to the troubled, jobless, or homeless, or for the protection of the environment. I'd like to introduce 3 people who have firsthand experience and can speak to the importance of maintaining our commitment to investing in a healthy society, and why recessions are exactly the wrong time for the government to be cutting back. I'll introduce the three of them and then you can each speak. Con Hogan, I'm sure many of you know, he's the Secretary of Human Services from 1991 to 1999. He had previous experience in the agency. He was the Commissioner of Corrections in the late 1970s. More recently, he's been very active in trying to reform the healthcare system. He's an author, but I know most of you really know him from playing the Cold Country Bluegrass Band. Tom Davis was Secretary of Human Services from 1973 to 1977 in the administration of Tom Salmon. He's the son of Governor Dean Davis, which helps to account for his long career in politics. He was the director of Senator Leahy's Senate office. He's also an author, because his fifth book will be coming out, I think you said in May. He's also an avid golfer, who can be seen playing with his son and grandson at Barry. Cheryl Mitchell was Deputy Secretary of Agency of Human Services from 1993 to 2002. She has a long history working with family and children. She's currently teaching and doing research at the University of Vermont. And in the interest of full disclosure, she's a member of the board of Public Assets Institute.